You know, for a long time, healthcare has been what we call patronistic, right? We have decided in the past what's right and what's wrong for the patient. What we've recognized over the last number of years, a good 20, 30 years, increasingly, is that the presence of the support for the patient as far as their loved ones go is extremely important. All in all, what it does is it helps the healthcare staff create an environment that allows the patient to heal.
I think family presence will be win-win for everybody. I work as a spiritual care provider and spot at least some measure of anxiety in nearly every hospital bed. Having family presence would help decrease that anxiety, increase communication, and increase safety.
I think we have to recognize that a hospital stay is one brief period during a patient's care journey. It started before they got to hospital and will carry on afterwards. And that's a chunk of time that's in the hospital. It may be a couple of days, but it may be several weeks. Regardless, that's just one small section of their whole care plan. And the family was involved beforehand. The family should be involved during, because the family will certainly need to be involved afterwards.
Right.
We as healthcare providers are a guest in their lives. They've had a life before they came to see us. They'll have a life after they've come to see us, and so we just interact with them for such a brief period of time, but yet it's such a powerful period of time.
I'll just say I've been in all three areas. I've been a patient, I've been a nurse for a very long time, and I've also had a family member go through surgery and was allowed into the recovery room with my mom because of communication issues. It really helped the staff there. As a nurse, I really appreciate when family come in when I need them and when it's appropriate.
Generally, it does make the patient much more comfortable, and when we're speaking, we try and make sure that the patient as well as the care partner provider have understood the messages.
Well, anytime a patient is in the hospital, it can be a scary experience, not familiar at all. So it's nice to have faces that you know, people that are around you that are your loved ones or friends and family that can ease that discomfort of being in a place that is completely unknown and unscary, and it's a trying time. So it's nice to have family there to support you.
Perfect.
Throughout that.
The family can advocate for the patient's need. They know the patient better than we do, so they can be another voice for the patient when the patient doesn't necessarily have one.
To be honest with you, as a new nurse, I really had a hard time understanding the importance of that. But as my career's moved on, I do see how patients benefit from having their families around. Patients, they belong to their families before they've ever belonged to us, so they're more relaxed, they're more comfortable. It's actually easier for information sharing as well.
Imagine if you're married to the same, like I've been married to the same guy for 45 years now, right? 45 years, and it's a constant. I mean, occasionally he's away, but do you sleep at night when he's away? No, I don't, not really, off and on. So when you're in the hospital, somebody you slept beside for 40 years is not there anymore.
Often we have to discuss options regarding the surgery or the anesthetic, and at that time when you're under stress, it's easy to forget things and it's difficult to make even small decisions. And I find that if a family member, a trusted family member is there, it helps them to unload some of the decision-making process, helps them to remember things more clearly, what's happened in the past, and quite often we get a more clear picture of what the path ahead should be.
When you're describing surgery and the risks of surgery with patients, often the information just goes over their head because they're so anxious about being in the hospital or contemplating big decisions about their health. If there's a family member there to ask questions and provide that information to, the patient's often more relaxed and has a better idea of what's going to happen, and then can make better informed decisions about their care.
I think it's a good thing. We advocate for our patient-centred care, and as nurses we seem to see it from the nursing side and seem that we need to know what's right for the patient all the time, and we take a lot of control out of the patient's hands, the family's hands. To keep that patient at the centre of care, we need to involve family.
My mother was on my home unit last year, and being able to be in the unit and be with her and see how she was doing was supportive for her. It was also supportive for me.
The fact that you're able to have support from loved one in the hospital, I think is a really important part of the care team for the hospital, and it's a great initiative. Our foundation is really proud to be one of the supporters of this new push to include loved ones and part of that whole family care.
I remember as a child being in the hospital. I was 5 years old with a fractured leg, and I'm sure I was in there for 2 weeks. My mother said it was only 1 week, but there was limited access to my family, and for the most part I was terrified the whole time I was there. So I think it's wonderful that we can let patients have their family included in their care.
I think really family care, family involvement in patient care comes down to one word and 4 letters, and that's love. And I think love moves mountains. Love makes miracles happen. And even in the very worst of situations with the very poorest of outcome, love brings to that experience something that nothing else can. No medication, no healthcare professional, no matter how many years of experience we have, love beats all. And as healthcare practitioners, I think that we demonstrate loving behaviors. I think we can be compassionate and caring, but nothing replaces the love of a family member or a friend.